Hi everybody, my name's Christy. I'm from South Coastal Rhode Island, which is why I'm a little bit late to the party here. We got hit by Hurricane Henri over the weekend, so I lost electricity for several days. But I'm really glad to be back here starting the class with all of you. So I currently work at a local community hospital where I have different roles within the hospital and the community. I am a community health worker, part of the community health team, and we attempt to provide a holistic view of patients between providers, specialists, and the hospital. We try to address behavioral health concerns as well as social determinant of health needs. Try to eliminate unnecessary emergency room trips and offer a lot of preventative education, psychoeducation, so that patients won't end up with conditions that would have them be hospitalized. Another one of my jobs within the hospital is in the emergency department. I'm a care coordinator, and I try to find appropriate dispositions for patients who are in there for behavioral health needs, including addictions. And I just started on the Women and Newborn Care Unit, which I'm really excited about. We have a very elderly population, so it's super nice to be able to work with babies and young people. Not that I don't enjoy my elderly people, but it's a nice shift. And when I'm there, I'm working to try to make sure we have safe and appropriate disposition for mom and baby when they leave the unit. So, and also to make sure they have the supports to help them be successful when they're at home. And my beliefs about mental health diagnosis, I think it can be a very validating diagnosis to people who have been wondering, why they might have certain tendencies. It can be helpful for sure. It's a great place to start. It might lead people down the right direction for an appropriate treatment modality or medication. I've also seen where the diagnosis has been misused and inaccurate. I've seen physicians throw a diagnosis, a mental health diagnosis, in a patient's chart after only meeting with them for maybe 15 minutes. And this, these are patients who may have just had a very significant diagnosis made to them for a physical condition. They may have been diagnosed with cancer or another disease. So what they're displaying might not be something that, they typically display. So that's, I guess, one part of mental illness diagnosis that I'm not so keen on. But ways that I participate to make a DSM-5 diagnosis. I'm really lucky that our social work department is very small because we are a very small hospital. And I'm able to learn from my coworkers, and they let me participate and see how they make a diagnosis and what factors they consider. A lot of times we factor in as the person, having a medical concern. Like, do they have a urinary tract infection? Because that can cause an altered mental status. Is it a diabetic emergency? That can cause someone to present as they're having an altered mental status. A lot of neurological conditions and such. So I have that unique perspective, and that I'm grateful for. And they show the fine nuances that you need to be mindful of before you would make a diagnosis. And kind of using your DSM-5 as a starting place. But that's it. I'm looking forward to learning more from all of you, from our instructor. So thanks so much. I'll see you in class. Bye.